Hey guys, how you doing? I'm Dr. Joe. I'm a chiropractor here at Full Function Rehab, and today we have Dr. Andrea, who's also a chiropractor here at our office.
How you
And
doing?
today we're going to be talking about chiropractic and trying to debunk your fear of chiropractic care and why you should see us and why you shouldn't be scared of us. Like really, what did we do to you? So
I don't know.
yeah, I don't know. It's interesting, but that's what we're going to talk about today and give you a little bit more informed information as to what we do and how we can help you. So let's get started. Dr. Andrea, so what is chiropractic?
Well, chiropractic, we're a primary healthcare provider in Ontario. Like you don't need a referral to see us. And we assess you like any other doctor would do. We get a complete history of your past conditions, your current condition, why you're seeing us. Then we go through and diagnose you. So we use tests to assess your muscles and joints and nervous system. And based on whether we can treat you or not, we further manage you. So if we can treat you, we treat you in clinic using our techniques such as ART or Graston, using soft tissue relief, adjustments, the crack quote unquote that we're famous for. But if we can't treat you, we refer out or send you for an x-ray for further management.
Yeah, that's great. So technically we're trying to diagnose you properly. We take proper history, we examine you, and if we feel that we can do it and we can help you, we'll do it. If we need to do something else, we'll do that as well. Based on what your issue is, we'll develop a proper treatment plan to get to the bottom and give you the best course of care as we can. But let's go back to what you just mentioned. So
Sure.
you mentioned that the crack.
Yeah.
So the chiropractic work that we do, we crack backs, crack neck. Are we really cracking anything? What's happening there?
No. There's no physical cracking of material like how you would crack celery, you know?
Yeah.
It doesn't break in half.
Yeah.
There's two sides to every joint, and we're just separating the surfaces of the joint. That's the separation sound that we hear.
Exactly. Because
Yeah.
technically, if we were cracking people's necks, cracking backs, we'd be breaking them. So they'd come
there's
in
no
our
break.
office, we'd break them, and then they wouldn't be able to leave.
No.
No. So technically, the crack
Yeah.
is in lay terms.
Yeah.
But what's really happening? So the scientific explanation is so you take a container. So we'll use a physics explanation. You take a container, and what happens is you increase the size of that container. So whatever's in there now has more room. So there's less pressure in there. So typically when that happens, if there's less pressure in the container, you might have more space and you might have a release of gas. And you can have a release of air pressure. So same thing happens in the joints. You have a joint. With an adjustment, you are increasing the space within that joint, and now that pressure in the joint drops. You get this release, this audible sound, the crack sound, and now the joint has more space, has more room to move. People feel that much more release in whatever joint, whether it's ankle, knee, because now they have more range of motion. The joint's able to move and twist better because of the adjustment gapped it a little bit more to release the pressure.
Yeah, and I know some patients, they self-adjust, but it's not really an adjustment.
Yeah.
They
So-
self-crack.
Yeah, so they crack their neck.
Yeah.
Right? So they're okay doing it on their own, which is interesting because patients come in all the time and said, "Oh, you're not gonna crack my neck, right?" And we start asking, "Well, why not? Your problem is may require that." "Oh, I do it on my own, but no, you can't do it." So we find it's pretty interesting. It's pretty interesting where we go to school to learn specifically how to do that. We actually had to learn on each other.
Exactly.
A novice,
Yeah.
never done it before. I learned on him. He learned on me. It's just a part of learning in healthcare.
We're still here.
We're still here. No problem. Thank God. And we try and do that to our patients as well. So we treat them accordingly. And don't forget, as doctors, we know how to rule out potential candidates. We check blood pressure. We determine family history, social history. And if someone is not a candidate, we don't do it.
Yeah.
If somebody is completely scared, we don't do it. There's other ways that we can help people decrease their pain, increase their movement without doing an adjustment. It may be effective, and we always educate people saying, you might be missing that last 60% of relief, 80% relief because you don't want this.
Yeah.
But doesn't necessarily mean we can't help you in general.
Yeah.
Right?
Yeah, you touched upon a good point. I just wanted to add or emphasize more, because you did state that in our core curriculum, we are trained to identify who is a good candidate for adjustment and who is not a good candidate for adjustment.
Mm-hmm.
So
yeah, somebody who may have...
It's not for everyone.
Yeah,
Yeah.
not for everyone. And part of our job is to determine if you are a candidate.
Yeah.
So thinking that we're going to do it to everybody,
Mm-hmm.
that's not our style.
No.
It might be somebody else's style, other chiropractor style, but we don't do that.
Mm-hmm.
We take the best approach to your care using multiple tools in our toolbox of what we learned in the past and how we implement it, and we could try and get you better. So that whole fear in general is something people have of chiropractic, afraid of heights, things like that. And sometimes it could be acquired or it could be told. So
Mm-hmm.
someone tells you their bad experience, or someone lets you know, like, oh, why are you going to see that guy?
Yeah.
So you may not even have gone to see a chiro, but you're scared of us. And my suggestion is try it out. You might be really surprised as to how a chiropractor can help you, what we could do for you, how it may help you in the long run, and you could get over your fear because of your comfort level will be a lot better.
Mm-hmm. Yeah, I mean, you never know. It could be, like we said to this patient this morning, it could be 3 visits and you could be better, you could be cured. You never know unless you get an honest opinion, a full assessment, that we do our due diligence, we cover all our bases, and we say, look, this is what we think is going on, this is what we think will help. And we're doctors, we're trained to give you our best opinion and given with what we have.
Exactly.
Right?
Exactly. So, I mean, our suggestion for you is if you're having any issues, pain, tension, not just the back and neck, which is what people think all chiropractors can treat.
Yeah.
Certainly not
It's
him and
more
I.
than that.
We could treat more than that, the knees, ankles, hips. If you're having any issues, don't be scared. Try it out. Try it one time. Let the chiropractor know your hesitation.
Mm-hmm.
They will understand. They will let you know if they can even do it on you based on your current health history, or even your genetic history based on family history.
Mm-hmm.
And that's it. But make your own honest decision and see if it may help you. You might be pleasantly surprised. Yeah. So we want to thank you for watching. Hopefully this gives you a little bit more insight into chiropractic care and how it may help you. But just try it out for yourself.